So research was very difficult when internet was not there. But now this literature search is very easy and you do it through internet. Now in this talk, I will give you, please remain attentive. I'll give you a very practical, quick way of how to do a research, to do literature search. Let me repeat again. You have an area of interest from where you took a research objective and then you wrote down the operational definition. Now you clearly know what you want to do and then you go on literature search. Now literature search you make from journal articles, from research projects, from conferences, these are the areas which are acceptable. They are acceptable, body of knowledge. Now, what you do is, how you do is that I'm sure you are aware of it, that whatever was your learning, research objective, you pick the keywords out of that. Because these keywords will actually help you to find out what has already been searched, right? And then there are so many websites, but this one I always use. If you like, you can take a photograph of it. If you like, I remember it by heart, which is actually PubMed. It's an American thing. It is an international thing. So this is the link. And for most of our clinical works, this is enough. Although there are Medscape, there are other research engines as well. You can search it through Google as well. And there are other very targeted professional, search engines as well. But this is the one which most of the time is sufficient for me. And when you just open it, it will look like this. And here you write down your key object, the keyword. For example, you wanted to do hypertension and diabetes. This was your research question. And you wrote diabetes. See, you get 1, 2, 3, 4, 5, 6. 1,62,306 articles. So what you need is, you need a go down full of paper and a truck to have all those paper, 2,000 printers, and print all those articles. So you have done a literature search. So what will you do? You wanted to know everything which is there about diabetes and you got it. Now, this is why you find so many keywords. You put another keyword, which is diabetic hypertension. And now you narrow down it to 1,657. But still then there are too many. That will need, thousands of papers. You further narrow it down and you say diabetic hypertensive nephropathy, and now you have got 3,010 articles. Still there are too many. But if you can see this end of the screen, you just read this article, see whether it is relevant to you or not, and just tick it if it is. If it is not, go down and go for the next one. So out of 3,000, you select those articles which are really going to benefit you. And then there is a facility there on this page that you can either copy it and paste it on your master file, or you can print it. So depending what is your choice. So what I do is that whenever I start a research, I just write down all three things, area of interest, blah, blah, blah. And when I come to a literature search, I make a master file. And whatever I get, I keep on pasting it in that master file. So up till now, you have an area of interest, you have got a research objective, and you have got operational definitions, and you have got all the literature which is present there in the body of the knowledge on your word master file. And then you have to go through it, and you keep on deleting which is not related to you, and you keep on saving which is relevant to you. In my opinion, for doing one research, it will require on average at least 1 week when you don't do anything else, right? So once you go through all the literature search, it is quite possible that will give you a strength that good, I have selected a right objective, and it's nice that I'm doing a research. It is quite possible that you may have to go back and revise your research objective, because now you know more about that phenomena and you can now revise it. Or maybe you just cancel the idea. You said, okay, I'll keep the area of interest, this one, but this research objective is actually of no use. And you can go back and find out another research objective. And very rarely it is quite possible that you may even change your area of interest. So this is how you do it. Okay. Now this will take, if you are doing only this thing, 8 hours a day minimum, about 1 week. And now it is just like preparing a feast for the guests. You have got all the vegetables cut. You have got your meat washed. You have got your table set. You have got all the masala jat ready to make a research. Okay, so this is why I just said what next, what to do. Now, the second part, before this part, you can always revise and you can change your plan. But once you have come to this part, now you cannot change. It is just like drafting on the paper. You can make a bathroom bigger one or a smaller one, and you can just put your wall on one side, and you can make your living room bigger than your bedroom, etc. But once you have started constructing it, you can't change it. So this is why it is advised that you do spend your maximum time in finding the area of research, then research objective, then operational definitions and literature studies. And once you, the first step is research variables. See, you remember when I defined research, I said it is systematic collection of, it's a systematic data collection and then interpreting, collecting it, analyzing it, and interpreting it. Now, what you going to collect, what you going to interpret, what you are going to analyze, they are called research variables. Variable is defined as that thing in your research objective which can have different values, right? For example, let me go back to our initial example. In this example, anemia, hemoglobin level can have different values. You want to do a study in 1,000 people. Now, patient 1 will have another hemoglobin, patient 2 will have another hemoglobin, patient 3 will have another. So, in this example, our variable will be hemoglobin. The outdoor is not variable, but hemoglobin level. So, in this simple example, in one research protocol, you may have got a research objective in which there may be many variables, and you want to know, like our example with diabetes and heart patient, there may be many variables in that, depending upon what type of research objective we have framed. But in this example, I wanted to make it simple. This hemoglobin will be variable, and the other variable, dressing A will stay in hospital for 3 days, and with the B average stayed for 5 days. So that will be the variable, right? Similarly, in this case, whether we had interrupted silk and then whatever will be the variable criteria. So in order to make the story short, variables are those values which can take different values. In other words, it's a character that can take different values. So once you start doing a research, now you have to start collecting a data. In order to collect a data, you have to make forms or survey forms or questionnaires, and they will be made on the basis of variables. And please remember that so for example, age is a variable, hemoglobin level is a variable. For example, if you want to do a research, what is the impact of having FSC or A level on the academic scores of students in first professional examination? Now this academic score will be a variable. Similarly, hospital stay will be a variable, right? So when you start a research, from the research objective, you try to find out the variables. Please also remember that variables may be dependent variables or it may be independent variables. And please also remember, this is a very important slide. If you are doing something else, please stop doing something else. If you are playing with your mobile, our viewers, please turn off your mobiles and just focus on this slide. See, just focus on this area. there is a value which is affecting another value. And finding it out is actually research. It is actually, this is research. But once we are doing it, there may be some other factors which are affecting the outcome. Because when we said, for example, in one example, that why is there more incidence of heart attack in patients with diabetes? Now, the simple thing, if we just forget this one and just focus on this one, we will take patients who are diabetic, and after a period of time, we'll see how many of them had heart attack. And for example, out of 100, 7 had heart attack. We say the incidence of heart attack is 7%. But please remember, it is possible that some of them were female, some of them were male. Whether having a different gender has got an effect or not. Secondly, some of them had BMI 30, some have BMI 40, some have a very fat 55. Some of them had associated hypertension, some didn't have. Some of them were malnourished, some were not malnourished. Some were smokers, some were not smokers. Someone were, village dwellers. Some of them were living in urban areas. So all those things, they must have shown its effect. Now, these cause and effects are called dependent and independent variables, and those which can affect in a hidden, indirect way are called confounding variables. And the researcher is a very good researcher, an excellent researcher, if he can identify the confounders. And if those confounders are not taken care of in the research, then the result of the research will not be able to add anything in the body of the knowledge. And now please listen carefully. This is why I asked you to stop doing everything and listen carefully. Just put your 100% focus on my voice. Please remember, confounders are addressed through a process which is called inclusion criteria and exclusion criteria. And that criteria is better if we address it in our research objective. In this way, to find out the incidence of heart attack in male diabetic patients. What we have done, we have taken care of one confounder. To find out the incidence of heart attack in male diabetic patients below age 40, having BMI from this range to this range, and who are non-smokers. Now, when you say like this explicitly, you are actually including some of the people. You want to express that what are the values you want to include and what group of the patient you want to exclude. So in other words, just to describe your research intention in the form of research objective is not enough. You have to take care of the confounders. And this is why variables are being sorted out very carefully. If something, doubtful comes in your mind, you have to twist your research question in such a way that your query and your worry is being addressed. And many of the time when you send a research and your reviewers actually find out those confounders which you never thought of. And they say, how can you say that this is responsible whereas this confounder has not been addressed? So whenever you are devising a good research, that research must be, those confounders must be addressed. I hope this point is clear now. So the variables. Now, once you find the variables, now you really know that these things you have to find in your population. Now you know that this type of information you have to collect from the population where you are doing the research. Okay, now the next thing is now to design the study. Now you have to design the study. Designing the study means that you have to invite your friends for a dinner, and you have decided that dinner will contain continental food. And then, or you thought that no, dinner will have English food, or dinner will have Chinese food. So depending upon which type of population is there, you have to arrange your table and your spoons or knives or straws in a different way. Now, this is what is called study design. Now, you want to get the data, but how you do it, and this is something which is very confusing for the students. So again, I would just try to make it very simple. Please remember, see, now we are at the phase where we have to design our study. We have to design our process of collecting of data. Now, please remember, I will try to make it very simple, and all those confusing names will become very simple for you soon. Please remember that study can be descriptive or can be analytic, right? Now, what I do is in live workshop is that I go out and I come back in the room and just look at the participants for 30 seconds and then say, well, in this conference, in this workshop, there are 20 people, 8 out of them are girls, 12 out of them are gentlemen. Out of 8 girls, 6 are wearing niqab, 2 are not wearing niqab. Out of boys, 11 had beard, others they don't have beard, 2 had a cap on their head. Out of those 8 girls, 4 girls are incidentally wearing red colored dupatta, and there are 2 girls who are wearing jeans, and out of boys, 8 are wearing shalwar kameez, rest are wearing shirt and trouser. Now, what I'm doing is, I'm not doing something from my own. I am just observing and describing. When you do this type of thing in a research, it is called descriptive study design. And how you decide that it should be descriptive or it should be analytic, this will depend upon your research question. Because your research question will actually guide you that what type of study design you have. Now, there are many actually, but there are 3 type of main descriptive study designs. Now, one is when you find something unusual, when you find something different, and when you have managed a clinical problem in a different way. That will be called a case report. It is just a description. You have not done any intervention in it, so this will be called a case report. Right? Sometimes thing is not unusual, thing is not very novel, but since the quantity is more, so it is worth presenting. Because when quantity is more, then you can make some conclusions, right? So that is also be a case series. So I hope you understood it, that when we say case series, when similar type of patients, similar type of procedures, when they are described together, that will be called case series. The third one is cross-sectional study. This is just like, and the activity which I do is, just visualize that there are 20 people sitting in room, and I ask them to do whatever they want to do, and I take a photograph. And if I print that photograph, one person will be just sitting in a gloomy way, another person is laughing, the third one is just rubbing his head, the fourth one is trying to find something in the pocket. So can I say that person A is always gloomy? No, I can't. It was only a snapshot. So when we do a research in such a way that we try to find out something just at one spot, this is called cross-sectional study. Just for one spot. Now, why we do it in this way? Because that sometime our research question demands it. For example, we want to make a hospital which can look after the COVID patients. Now, in order to spend so much money over there, we should know that how many COVID patients are present in our city. Now, what we do is that we just devise a questionnaire, and on one day, we send 30 teams in whole city, and they find out how many COVID patients are there. So for this type of study, where we have to find out the prevalence of a disease or a phenomena we do cross-sectional type of study. Many of the epidemic studies, many of the pilot studies are those which actually provide us data to devise the larger studies. They are done through cross-sectional studies. So incidence of polio patients in Pakistan, this will be requiring a descriptive cross-sectional study design. Then we call it cross-sectional study. What is present at this movement? What is not present in this movement? When you want to find this one, it is called cross-sectional study. And I gave you an example. Incidence of polio patients in Pakistan. Or, for example, no, not in the year. That will be prevalence at one spot. So similarly, you can say prevalence, Then similarly, you can say, what is the percentage of literate people in Pakistan at this moment? So when at one particular spot in time, you want to find out the situation, that is cross-section. Okay, then. So this is what is called descriptive type of study design. And I have told you that as you will become more experienced, you will just learn that what type of study design you want to use for this type of research. For example, if someone is doing laparoscopic APRs and he has to publish his data, this will be case series, right? So I hope it is clear now. Now we go on to the second category. You remember I gave you an example that I came in the room and I just observed that how many girls are there, how many boys are there, and what are they wearing, and how many have had beard, and how many have had hijab, and how many do not have that. Now, this was description. Now, if what I do is that I find it out that right side people are talking more than the left side people, and I ask the boys to get up, 3 of them go on this side, and girls come on this side, and I find that suddenly noise just disappears. Now, this is what is a kind of an analysis. That's kind of analysis. In fact, okay, let me say it again. I just went there and I found they are sitting there, and then I noted that the side where predominantly boys are sitting, it is more noisy. And the side where predominantly girls are sitting is more noisy. And the area where boys and girls mixed are sitting, that is quieter. Now, this will be observational analysis. It is an analytic study, but it is an observational. Okay, this is an observational analysis. I just observe and make an analysis that this is perhaps because of this, that same gender is sitting together. This is why they are talking more. Now, I hope it is clear. Now, this observational analytic study. So, one is descriptive study, other is analytic. And analytic study is further divided into 2. One is observational and other one is experimental. So, I'm describing observational first. Now, there are 2 actually examples of observational study. One is called cohort study. Now, when I never knew this word, I always thought that this is kind of a French or a German word, and I never understood it. But when I learned this meaning, and you will shortly learn it, cohort is nothing. Cohort is a population which has similar characters. For example, in our previous example, if we are studying diabetic patients and we want to know that how many of them had heart attack, then this diabetic patients, this study will be a cohort study. It is observing and making an analysis on a population which has got a similar character. That will be called a cohort study, right? So, okay, it's not moving. These we have discussed. This was, okay, forget about it. Now, this is cohort study. Cohort study is just like this. You have got a population, you pass through a time, and then you see that how many got sick, or how many got affected, or how many did not get affected. The example is the same which I gave you, that what is the incidence, what is the incidence of heart disease in patients with diabetes. Now, this study will be called a cohort study. Now, this cohort study can be done in past and this can be done in future. For example, what we can do is that we can take all the records of patients who were diabetic and then we go through the record and then see that how many of them had heart attack. Now, when we do like this will be called retrospective study. And if we just take all the diabetes patients, register them, and following them for a period of time, and at the end of the period time, we study that how many of them had heart attack, which will be called prospective study. And you can very easily answer which one is a more stronger study. Obviously prospective, because in retrospective, there is a chance that that data, since it was not recorded for the purpose of research, so there may be some faulty data, there may be some missing data, there may be certain confounders which were not taken care of and their data is not being collected. But when you do a prospective study, you thought of research. You already have in your mind that this is the factor which you want to study. So you collect the data in such a way that your data is complete. So I hope you understood now that what is cohort study. Cohort is a study design in which you take a group of people with a similar characters and you follow them either in the past, you track them either in the past or you follow them in the future and you just observe the effects on them. Now, this may be interventional as well, which I will describe later. Now, the problem with the cohort study, we have already discussed that it does not take care of the confounders. It does not take care of the confounders. So, case control study is actually a cohort study, but it is designed in such a way that apart from studying that group which had a disease, another similar group is studied which does not have a disease. And then they are compared together. When we compare them together, so it is possible that if someone out of 100, 8 patients had heart attack, and you said that there is 8% incidence of heart attack in patient who has diabetes. Now you have 100 other people who are not diabetic, and when you just followed them, you found that 7 out of them had heart attack. So this was the normal population. And when you see the result of first study, it will tell you there is 8% incidence. But when you actually compare it with the second study, in which you had a control group, then the result of the first study just becomes meaningless. It becomes totally meaningless. Because a person, in order to have a heart attack, may not be diabetic. So when you design it in such a way, let me repeat, what you do is that you have got a group of people with similar things, you study an effect of something on them and calculate the result, and then you have another group which either had the disease but did not have the dependent factor, or other way around. Right? You had diabetics but they did not have a heart attack, or you had heart attack but they were not having diabetes. And this group is called control group. And when you compare them together, now the results will be more meaningful and authentic because it will be taking care of the confounders. Now, when you design it in such a way, this will be called case control study. It is something like this. Select a population, those who developed a disease and those who did not develop the disease. And then you compare them together. This will be possible. So let me just summarize this segment of it, that one of the study design is analytic. And in analytic, we can have observational studies where actually we don't experiment anything. But whatever is there, we try to interpret it. One of them is cohort, when it's a simple cause and effect study, or it can be case control, in which this is coupled with another study which has got cause but no effect, or effect but no cause. And then you compare them together and this will make it good. And how it will become meaningful, we will learn at the end of this presentation, which is through P factor, which is called P values, which is the statistical method of making something, understanding something as their significance is concerned. Now, there can be another way. I'll come back to that example. You come in the room, and what you do is that you ask the girls to stand up and go to the other side. And you ask the boys to go on the other side and see what happens now. Now, this is called experiment test, where you actually do dressing A, dressing B example in our previous objective. That will be an experiment test, where what you do is that you have got two different, for example, what is the efficacy, to compare the efficacy of paracetamol and Ponston in patient with tension headache. Now here what you do is, there are some people which will be getting paracetamol, there will be some people which will be getting Ponston, and then you study it. So this type of study will be called experimental study. This will be called an experimental study. Okay, I hope. So this is what study design is. Not very difficult. I just skip this preventive trial and therapeutic trial. You just skip those areas. If you understand what experimental is where the researcher himself do some maneuvering with the cause, either with the cause or with the effect. That is experimental. So in summary, study designs are of two types: descriptive, which are case control, case series and cross-sectional, which are analytic, which may be observational, cohort, and case control, which may be experimental studies where you do some kind of intervention. So that is the study design. I think this is an important slide. In the case of experimental study designs, please remember, when we choose to intervene, for example, in our example of paracetamol and Ponston, after all, which we want to study it in 100 patients, one group paracetamol and 100 people are Ponston group. Now, how will we decide that which patient will get paracetamol and which patient will get the Ponston? If we decide it in such a way that we, on our own choice, we in our own choice decide, the researcher's choice to decide which one will get paracetamol and which one will get Ponston, then this type of study will be called non-randomized. And normally that's what happens in most of the studies. If you want to study this, 100 people, to any 100 people you give paracetamol, to any 100 people you give Ponston, and then you compare them. Now this will be non-randomized, and you can very easily understand that this will have less, although this is a scientific study, but it will have less value as compared to randomized. In randomized means, I know which patient is getting paracetamol and which patient is getting Ponston, but patient does not know it. We just get a consent form signed from the patient that, look, you are in this study. We have found out that it will not be harm. You give us the consent. So you pick up the lottery, and if someone gets A, he will be given paracetamol. If B, it will be Ponston. When you design a study in such a way, it is called a single blind randomized trial, because one side of it is blind. But if neither patient knows nor the researcher knows, it is called double blind, because it is quite possible that I may have a relationship with a company which makes Ponston, which is called conflict of interest. It is also possible that I have got a personal liking for Ponston as compared to Ponston. So that bias may be included in this research. So in order to overcome that, the authorities, they design double blind trials in which there is someone who is doing research, but he is not in contact with the patient. I am in contact with the patient. I don't know what tablet I am giving to the patient. It is tablet A, but I don't know whether tablet A is paracetamol or Ponston. And patient also does not know whether it is A or B. When you design it in such a way, that is called double blind randomized trial. And you can very well think on your own that which trial is more authentic, non-randomized or randomized. How we actually decide about study design, I hope now you have got a very clear concept.